Hi, my name is Bruno Silva. I'm one of the dentists at Brighton Implant Clinic, and today I'm going to be talking to you about the process of having a natural tooth replaced with a dental implant. You will need a minimum of 4 appointments. At appointment 1, your dentist will carry out an assessment to check if you're actually suitable for dental implant treatment. Essentially, they take a small X-ray or a scan and check if there's enough bone so that the implant can be inserted safely. The second appointment, your dentist will carry out the implant placement procedure. This can be done either under local anesthetic or sedation. With local anesthetic, it's really not painful. It takes about half an hour to an hour to do a single tooth implant, and it will take naturally a little bit longer to do multiple implants. If you're anxious about dental implant treatment, you could opt to be sedated. With sedation, you're basically in a twilight zone or asleep, and basically the treatment is much easier. It seems like time travels faster, and many patients wake up afterwards feeling like the procedure hasn't even started. During the healing period, you could just leave a space if it's a back tooth and you're not bothered with the missing tooth gap. But if it's a front tooth, you could actually opt to have a provisional crown fitted onto the implant on the same day of surgery. I must stress it's important that the implant is adequately stable, and it means that you would need to have sufficient amounts of bone for that to be possible. It's not always possible to fit a provisional crown because in some areas the bone may be limited, or the implant may be in an oblique or difficult position for an implant provisional crown to be done on the same day. So in summary, appointment 2 will basically be the implant placement procedure, and you afterwards will need to wait for 8 weeks for the implant to integrate. At the third appointment, this will be 8 weeks after the implant placement. Your dentist will verify if the implant has integrated fully. This will be done by taking a small X-ray and just checking that the bone is actually adhered to the implant. At this stage, we will take impressions for a final crown to be made. This can be done with either conventional impression techniques or with more modern digital impression. And with the digital impression, an intraoral scanner basically creates a digital file of the teeth and the implant position. All this information, or the impressions, are then sent to the dental laboratory, and the dental laboratory will basically then create a final crown that will be crafted to fit onto the implant. This tooth will be usually made out of zirconia. It looks and feels like a natural tooth, and it's going to fit precisely and snugly into the tooth space that you have. At the fourth appointment, your dentist will fit the final crown or implant bridge. This is relatively straightforward, only takes a few minutes, and at first it may feel as though the tooth feels very strange because you've been used to having a space for a few weeks. Usually after a few days, the tooth will feel just like a natural tooth. Your dentist may need to adjust the tooth slightly in order for it to feel comfortable, and they will verify that the crown fits precisely and perfectly onto the implant. We usually recommend our patients to come back for a review appointment after 6 weeks, just to ensure that they're getting on well with the tooth, that the tooth is functioning well, that nothing's wrong, and just to reassure the patients that yes, the tooth can be looked after, cared for, brushed and flossed just like a normal tooth. So I hope this video, I know that it's covering a lot of material in a short space of time. If you do have any questions, please feel free to post any questions in the comments below. You can visit our website. It's www.brightonimplantclinic.co.uk, and I hope to see you again soon. Thank you.